Good morning, and welcome to the December 11th meeting of the Audit Committee for the Savannah-Chatham County Public School System. I'll call the meeting to order. Our first order of business is a sad moment, but we're very proud of her service. We would like to recognize Ms. Wendy Owens. She rolls off our committee this year after service from July 1st to July 2019 to December 31st, 2025. So, Wendy, thank you very much.
Yes.
Thank you. Okay. With that, I'll entertain a motion to approve the agenda. It's been properly moved and seconded that we approve the agenda of the meeting. All in favor?
Aye.
The agenda is approved. The first item on the agenda is the approval of the minutes from the June 26, 2025 meeting, and we also need to approve the October 30th, 2025 minutes. Are there any additions or corrections to those minutes? Seeing none, I'll entertain a motion to approve both sets of minutes.
So moved.
It's been properly moved and seconded that we approve the minutes of the June 26, 2025 meeting and the October 30th, 2025 meeting. All in favor?
Aye.
The minutes are approved. The next item on the agenda is the Audit Committee Charter, the first read, and an approval of the calendar for the 2026 dates.
Thank
Leah.
you. To go over the charter each year, since we have some new members, we review this charter just to make sure if you all would like to make any recommendations. At the request of Hoskins Brown, we are bringing it as a first read and second read. That is something that is new this year. So when we say first read, if you all approve it as it is right now, we won't need to go to second read, but if there is any changes, we'll make the changes as requested, and we will move forward. We have shifted the date to review from the April 9th period to the December time period, because this is usually the rotation. We work on calendar years, so we thought we'd align that with the appointments excuse me, of audit committee members, and as well as the approval of the calendar years. So going through the audit committee charter, we talk about the purpose and the authority and membership, and in that it talks about voting members as well as service terms, as well as if missing any audit committees, if you miss 50% or more, that was one of the recent changes that we had as well. That if the member is going to miss more than 50% of the meetings in a year, the member should consider his or her commitments and will allow them to effectively serve as a board's audit committee. If the circumstances are due to health or out of jurisdiction engagements, the call-in option will be available. I just want to reiterate that call-in option is available. We have to have an in-person quorum for that to happen, just to let everyone aware of that process. But also Cheryl Hoffman monitors the attendance, so if we see there is an attendance issue, we do let George Woods know of that process, and he will speak to that as well. Does anybody have any questions of that area? Yes.
Just on the document in general, the only comment I have is under meetings, it says that the schedule is established at the beginning of each year, and we have committees that operate on different calendar years. So we have some that are on the state fiscal year. But we appoint our committees on the calendar year. So if we would just insert calendar there, then people in the future will know that this is Julian calendar year, not academic calendar year, not fiscal calendar year. Well, hopefully they would know.
We'll make that change. Responsibilities, these are the same information that was provided to you in your onboarding documents when you came on board with the audit committee. This is going through the financial reporting and accounting practices. This is providing oversight of the external audit coverage, which includes the review of the independent public accountants. That's the Malden and Jenkins that we have, work plan, of which that review actually is what they provide to you in our meetings, and the results of that audit engagement and any non-audit services to be provided by that accountant. Assessment of the auditor's independence, as well as that periodic nomination of the external auditor. The review of board policies and policy decisions, we haven't really done that before, but I know that has shifted a little bit as it comes to, in the finance committees, there's some policies going through that realm. That's not something that has been really discussed in the past or really done consistently. So I would like to lift up to the audit committee to think through what the thoughts are on that responsibility. Because the board policies, that's really broad, unless we want to specifically highlight the ones that affect internal audit department. We might need to, I would recommend considering that we really codify what policies would need to be reviewed through this committee. Any other questions of that number 1 section?
I'm sorry, I got distracted. Can you tell me which bullet point you want us to reconsider this being too broad?
So it's number 1, but it's the second star, review board accounting policies and policies decisions. We have accounting in there, but there are ones that internal audit sit in as well. But accounting policies is pretty broad. What does that mean? Are we only referring to, because many of those policies are going to other board subcommittees. And it wouldn't be, I think it would be confusing to the district if one, if we look at the same set of policies that are flowing through the finance committee or the same policies that are flowing through. That's something to consider since that practice is now beginning to occur in the CIC meetings as well as the finance committees.
I guess my only concern about that is the review making its way to full board consideration? Like at some point, when is that not just in the committee? Like with the audit committee recommendations, it goes to the full board every time we do something. But other committees, all of their actions, it doesn't appear, come directly through the full board.
Correct.
So do you have an example of this duplication that you're trying to avoid? Has it happened recently with like finance committee or something?
No, because no board policies, we don't bring those to you. You may identify them in the course of an audit, but we don't really actually review them within this subcommittee. And that's where we can do that, and we can share that with district as well as, what is said in the finance committee. I just don't want to duplicate the same policy that they may be looking at.
I think that given the climate around financial performance lately, that the optics wouldn't necessarily be good to say that the audit committee is not going to look at policies.
Okay.
That doesn't, but I think at any time, the committee can just decline to look at a policy. You know what I mean? It's like, it doesn't say it must review all 100% of all policies every year, all the time. It just says it's a function. So if on an annual basis, we decide we're not going to do one or the other,
Okay.
we're not out of policy. But to remove the review from this group after these bad audits and public response and all that, I don't love the optics of that.
Okay, no, that's
but I'm
fine.
just one person.
Yeah, I just wanted feedback because we haven't brought anything to you outside of an audit. And so I need to understand what your expectation for this practice is.
I would also agree with Jan. Just from a perspective about writing contracts, it doesn't say must, and it doesn't say shall, and it doesn't say all. It's vague enough that you're supposed to review them, but it doesn't say you have to review all of them.
Okay.
So I think it was purposefully written vaguely like that. I see your concerns with it, but I agree with her. It doesn't have that language in it.
Okay. So how do you want me to provide these to you then? Because it's a practice we haven't done in the past.
I don't know that this is, and I would agree with both of you, I don't know that this language is requiring a change.
Okay.
We will still approve the audit plan, and this gives us the flexibility to add something to the audit plan, but the board can ask, and the district leadership can ask for the audit, integration into the audit plan, and this just gives us the flexibility to do any of those things they want us to do.
Okay.
I just leave it just like it is. But I don't think it adds anything to your plate. I agree with you two. It doesn't add anything.
Okay.
If I may. So you asked, how do we interpret it? The way I have always interpreted this is if in the course of implementing an audit, you see something that has a policy connection that you need to draw our attention to,
Okay.
If there's a lack of a policy or a violation of a policy, then I would expect you would say, here's the audit, and by the way, the board ought to look at this policy.
Okay, good, good.
But I'm not looking for you all to do a full policy review every year with answers to us.
Okay.
I'm looking for policies to be part of the lens that you perform on your checklist of audits.
Okay, thank you for that clarification. I just wanted to make sure.
You're welcome.
Thank you. All right, number 2 is the internal accounting and control systems and processes. Oh, I need to remove that additional one. For meeting board goals, the responsibility of the committee in the area of internal control is to provide reasonable assurance that the district is maintaining an effective system of internal control, including IT security, and control is in compliance with pertinent laws and regulation, and is conducting its affairs ethically. To accomplish this, the committee, at its discretion, will provide oversight to the internal audit function. So I think we're still aligned with these processes. Again, the second bullet, assess the extent to which the planned audit scope of internal audit and the independent public accountant can be relied on to detect fraud and weaknesses in internal controls, and assess management's responses to reported weaknesses and compliance deficiencies. We currently do that. Use information from the external auditors, the internal auditors, and district management to assess the extent to which the district's internal structure is adequate to prevent or timely detect unacceptable levels of risk in district operations. Does anybody else, and I'm not going to read the rest, does anybody have any questions of the following starred sections?
Okay. Seeing that there are no other comments, those are, well, I think those are certainly within the confines. So is it possible to treat the first reading as the second reading?
Well, she did make that change for the calendar to change, but there's no
Right, so there's a,
contextual.
I've
Yeah.
got one, and you had one admitted,
One,
one, so I'll entertain a motion to treat this reading as that reading with those two additions.
I move that we accept the audit charter with the 2 noted corrections from today's review.
Second.
It's been properly moved and seconded that we accept the audit committee charter with the 2 corrections as indicated. All in favor? Any opposed? The charter is adopted. The next item is the calendar.
before we move on, I wanted to add on the 3 lines model. Are y'all seeing the 3 lines model on your screen?
Oh, no, yeah.
Okay, there we go. So what I wanted to highlight here is really how that charter is designed, is how the Institute of Internal Auditors, and we did make some edits to show its relevance to our district, that the way the charter is designed as well as the board resolution fits within these 3-line models. So the superintendent, the Board of Education, their goal is there's the governing bodies that make sure that we are accountable to stakeholders, the organizational oversight. The district departments, these are the actions of which they occur, have frontline and second line roles. And internal audit then is that 3rd line role that provides that independent and objective assurance, and consulting services that add that value and enhance the organization's operations. And then we have that external assurance providers. That is our Malden and Jenkins and our A&M, so to put some context into who those external people are. And so these lines going back and forth, that shows the accountability, the up and down is the accountability and reporting in that relationship. And then also the alignment between district as well as the internal audit is, working with communication and collaboration in reporting and so forth. Does anybody have any questions of the 3 lines model?
No, makes sense. Thank you.
Thank you. All right, so the next item is the proposed 2026 meeting dates. I have worked with Roger to try to identify when Chatham Day was and when all the other board commitments are required. So this is the best plan that we have come up with. As we know, these are all subject to change, so we need approval on this so we can provide this to the Board of Education for the January board meeting.
Any comments on these dates? Understanding that they're well out into the future and, again, subject to change.
Okay.
Seeing none, I'll entertain a motion. It's been moved and seconded that we accept the proposed 2026 meeting dates for the Chatham County Board of Education Audit Committee. All in favor? The dates are adopted.
Good morning. So we have completed our audit of the district's wellness center. So I'm glad to be here and share the report with you. For this audit, we had 5 objectives. So first, we were looking to determine if the center's practices comply with any applicable local, federal, or state guidelines. We were looking at intake and referral procedures to see if those facilitate accessibility and utilization by the intended populations. We're looking at the structure and the staffing of the wellness center to determine if services are delivered efficiently to those populations. We're looking to perform a cost-benefit analysis, comparing the center's operating costs against its measured outcomes, and we're looking at if the center's operations and programming support the district's strategic priorities. A little background about the Wellness Center, for those of you who might not be familiar with it. The Wellness Center offers a variety of services to students and staff in the district. So they offer counseling services for students, they offer consultations for staff, they handle the serious threat assessment protocol for students when students indicate a potential harm to themselves or to someone else. And they organize the district's annual wellness day and other wellness activities throughout the year. The Wellness Center operates within the Office of Instructional Excellence, and it's staffed by a wellness coordinator, 2 wellness counselors, and a wellness secretary. There's also a couple cohorts of school counselors who provide services after school hours, working with students. And they do that in exchange for supervision towards certification as a licensed professional counselor. And we found no prior audits that have been conducted on the Wellness Center. It's a relatively new entity within the district. So for this audit, we spoke with staff from 30 schools in the district, schools at all levels. We included charter schools, some of the alternative learning centers in the district. We reviewed documents and data from the 2024-25 school year, and we conducted interviews with school staff, with district staff, and a survey was sent out to staff throughout the district as well. And our key observations from the audit are that the Wellness Center operates without a defined strategic framework that would consist of a budget and metrics of accountability. And there are some potential limits in services provided by the Wellness Center and variability in district staff perceptions of the center's services. Before I dive into the observations, though, I do want to highlight some notable strengths that we found throughout the audit. The Wellness Center is a pretty unique and innovative entity within the district. We weren't able to find other districts in the state that have a similar center-based program that provides similar services for students and staff. The Wellness Center works collaboratively with district departments and community organizations and providers. It's utilized consistently by students at all levels throughout the district, at schools throughout the district. Its services are provided at no cost to families, which helps eliminate potential barriers for access for some families. Provides professional development opportunities for staff, especially those school counselors and those cohorts that are providing services at the Wellness Center. The Wellness Center is available just as a consultation resource for school staff. They can get in touch with the Wellness Center to kind of talk through any number of matters or concerns. The Wellness Center helps reduce the burden on community providers. Before the Wellness Center existed, a lot of these cases and concerns would be referred out to providers, where we're able to handle those in-house in a lot of cases now. And throughout the audit, we found that the procedures and processes used at the Wellness Center are consistently aligned with any any applicable regulations or guidelines. So our first observation has to do with that absence of a strategic framework. So one of our objectives was to do a cost-benefit analysis. And in trying to do that, we found that the Wellness Center does not have its own dedicated budget. Its funding is all through the counseling services budget. And it doesn't have metrics of accountability that are specifically aligned with the strategic plan. So we pivoted a little bit and looked to identify some financial impacts that the Wellness Center does have. And so we looked at the services provided for students and opportunities for staff as well. And so we looked at the services that are provided for students. There were over 1,600 hours of direct services provided to students during the previous school year. And we looked to see what would those services have cost if they were provided by community providers. And so we contacted community providers. We talked to 10. Some don't take private insurance. Some don't take private pay. And availability was also an issue. The Wellness Center is typically able to see students within 24 hours of a referral, whereas these providers, only one was able to do it within that timeline. 5 of them were within a week, and the other few were beyond a week. And a lot of these cases, students are removed from school for that serious threat assessment process. So the Wellness Center is able to see those students and get them returned to school much more quickly. And so we found a range of what those services would have cost, based on whether families had insurance and were using a copay or private pay. So it's a pretty significant range, but it's tens of thousands of dollars worth of services that the Wellness Center was able to handle at no cost to families. We also looked at the supervision that school counselors receive. If they were to seek that supervision outside the district from an independent licensed professional counselor, they're paying about $100 an hour for that supervision. And so the total value of that was about $7,000 potentially per counselor, and there's 9 of them. So over $60,000 worth of professional development for those counselors. We also looked to see how the services align with the district's strategic priorities, the strategic plan. The Wellness Center, like I said, they don't have designated metrics of accountability, but you can see clear alignment of the Wellness Center services with some of the KPIs in the district's strategic plan, specifically whole child development and employee well-being and morale. Those are clear ties from the Wellness Center services. But the Wellness Center is not collecting data to measure the impact in these areas. So there's anecdotal evidence that there's positive impacts and benefits here, but there isn't clear, quantitative data to speak to that. So our recommendations for this observation are to establish metrics of accountability for the Wellness Center that include measurable outcomes that strengthen alignment with the district's strategic priorities, and to create an annual budget specifically for the Wellness Center.
Thank you, Jack. I would just ask the district leadership that's here, how do you feel about, is the Wellness Center helping? Is this valuable? Okay. Then I think it's worth it. Any other questions? Yes, ma'am.
I understand why we had to use anecdotal evidence here because of, HIPAA and not having KPIs tied directly to what we were measuring with success. One thing, I do think it's nice that it's a unique situation that we offer, but I don't find that that's evidence of effectiveness, mostly because I worry about the low utilization. So it looks like, based on the numbers, 99.48% of students don't utilize the Wellness Center for counseling. So most of it seems to be for these serious threat assessments. Is that correct?
That is our highest source of utilization, primarily because if a student is found to be at risk for harming themselves or others, they aren't allowed in the school environment. With counseling services, we cannot force a parent to continue with those services or a student.
Got it. Any idea, I know that you said it's sort of under the umbrella of several different, like departments that make sense, I'll say. But do we have an idea of annual cost, like from salary to, because when you say, I think it was 1,608 hours of services provided for 4 employees, so supervisor, 2 counselors, and a secretary. Do we have any idea of what the annual cost is even, I know that it's free to students, and I like that we offer training to counselors. I think that is definitely a benefit if they're gonna especially end up in our schools. But any idea, like any roundabout for how much this is costing?
So from a non-salary perspective, it will range from annually between $10,000 and $15,000 in non-salary dollars. Again, as was shared earlier, while there is not a specific budget for the Wellness Center, the counseling department, which is where the Wellness Center sits in terms of oversight, there are funds that are allocated for the Wellness Center. So when we look at the expenses of the Wellness Center beyond salaried funds, there's a range there. Not
Is
sure.
that something that you think we could get prior to further evaluating this in a year? Just sort of see where we're at with a dollar amount?
Oh, yeah, absolutely. We can probably provide a more accurate expense report as it relates to non-salary funds for Wellness Center.
Okay, I would love that. Being someone that was in healthcare for a long time, I love that we offer this service. It seems very underutilized other than the serious threat assessments because students, it's mandatory that they seek something in order to get back into school. And I know that this gives us a better turnaround, which is very convenient for us. I think that's great for our attendance data. But I do worry with things upcoming with a little bit of uncertainty with, our budget and finance going forward. I would like to know if we're at least, not spending a fortune on this going forward. And one other thing I'll say is that with Peach Care, CHIP, Medicaid, et cetera, these services are not, at most with Peach Care, if you qualify for CHIP and you receive, the minimum of assistance for your healthcare needs, you pay maybe $10 for a copay. But by and large, this is free to the community if they seek counseling. And so while I like that it's something we can direct them to easily and we have a center that they can go seek counseling, it's underutilized and it is offered for free. So with that caveat, as long as we're not spending a fortune, I think it's great, but I do want to see where we stand budgetarily. So that's my 2 cents.
Thank you, and you guys will provide that data.
That's easy.
Yeah.
Salary, non-salary.
Okay, thank you. Are there any other questions? Yes, ma'am.
I just want to comment on the utilization of the Wellness Center, and I think there's still some growing that we need to do in terms of having young people and parents utilize the center. I think one of the values of the center for us is that even though individuals may have access to counseling through either their parents' EAP programs or through state or federal sponsored programs, a lot of times folks won't go. The young person won't go. You can't get them to agree to go. You got to try and drag them, kicking and screaming to go, and just won't participate. But there's something about something being more obligate, that you're at school, there's been a challenge, or you have manifested a challenge that needs attention, and the school engaging and saying, we have this resource and we strongly, strongly recommend that you utilize it. There's something different about having something that is, in which the schoolhouse is a partner, and is facilitating it versus sending the young person home and saying, tell your mom to take you to go talk to somebody, type thing. And I have observed that. One of the other challenges with using our center is that the timeliness of it, and this is not the fault of the staff, I think it's, or anything, I think it's just kind of how it's organized. The parents whose young people I know who truly needed to be there, like I will pick you up and take you myself, you need to be there. Those parents could not get to the wellness center very quickly after their young person was showing needs of talking to someone. They couldn't get there. They definitely couldn't do the 24-hour, the quick 24-hour. And this was not necessarily a young person who was going to harm themselves, but certainly was being very disruptive and had some things that they probably needed addressed. That parent was not going to be able to get them there in 24 hours. They did not have a car. They were working in a middle-level position on the other side of town that wasn't going to get them there. So we have this wonderful, terrific resource that leverages our desire to address the different challenges to education, which could be discipline or wellness, but the way that we implement it limits how some folks use it. So I don't want us to think that the utilization is driven not by need or even by desire of parents to utilize it, but one is cooperation, one is how we implement utilization of it, and the other thing is if you have young people who are on the verge of hurting themselves, then the priority of getting there is much higher than someone who might just be a classroom disruption. If you're just a classroom disruption, maybe the parent just gets another phone call. They don't like the phone call, but they don't go to the wellness center. But if you have a young person who is considering or manifesting ideations of self-harm, then yeah, they're going to get there. So I think that the patterns of utilization look like common sense of how we see human behavior. But I think maybe we can find ways to tweak our implementation, and I know we don't have it, I know we don't have the money, but if we had telehealth, like if you could be at your school and talking to someone, we do, okay. So if we were amplifying the use of that in a way to create more interventions, I think that, perhaps it would look more like the bargain and the necessity that it is.
I think the biggest implementation challenge that's come to my attention specifically from students is just the lack of awareness that we have it as a resource. So, that's what students have said. They didn't know it existed. So one of the things that we've done in the last 3 to 5 months is we've had the Wellness Center come to Student Senate, share what services are offered, and those students can then serve as ambassadors. But for me, it's more, from what I have observed qualitatively, it's more of an awareness issue and not necessarily we don't need it.
Is it awareness with the young people that need it? Like,
Well,
I'm going to stereotype Student Senate students as
yes.
high-functioning young people that may be dealing with stress or anxiety, but they're probably not the classroom disruptors.
Right, they're not mostly.
So,
But if they don't know,
and are the high flyers, we've sometimes called them high flyers, are the high flyer classroom disruptors, are those Student Senate young people the influencers for that group? And I don't know.
so I have worked really hard. I've not yet gotten quite the profile nailed down, but in my initial vision for Student Senate, I did want to diversify with the type of student that attends. That vision hasn't quite been realized yet.
Okay.
We're still mostly working with our more successful students.
Okay, thank you. Well, those were just my observations of utilization in parents and young people that I've engaged in their obstacles to participating.
Good morning. You did address many of the things that we are focusing on in the Wellness Center concerning utilization. One of our most imminent plans is to not just be receiving students at the center, but to go into the schools and provide services We have a very limited staff with a lot of students and a very high need. So one of the things that we're going to do is not just our counselors providing groups, but also helping our school counselors to lead those groups so that we can reach more students and use more of the leveled or tiered approach to helping students in need. So we'll start with those SEL lessons in the classroom, small group instruction, so those students who, we may have 10 students in the school that are all experiencing grief. Well, we can work with all of those 10 students in the school setting. If they continue to struggle, then we can look at, they may be more appropriate for a referral for individual counseling, either using our telehealth through Hazel Health or coming into the Wellness Center. So we are looking at ways to improve our utilization by spreading ourselves out more and going to those students where they are. The telehealth has helped with the transportation issues that we've seen where parents are saying, I want to come, I want my child to get this service, but I just cannot, I don't have transportation, my car is broken, financial,
Right.
whatever that circumstance is. So that has been helpful to many of our students, being able to get that service in the school. I think the other topic that you all mentioned of us, people knowing that the Wellness Center is there, students and staff to be able to utilize the services more is definitely a high priority for us. The way that we are trying to combat that is we are participating and working with family engagement. So going to events in the community, going to events in our school to let families know that, hey, we're here and this is what we offer and this is how you can utilize these services. We're also working on accessibility so that there's the ease of parents being able to refer to the center. We know that the more steps you put in place, the harder, the more likely people are not to want to use the service because they feel like it's too much that we're asking of them. So we're looking at streamlining that particular avenue as well. So you all mentioned things, and I just wanted to highlight that we are working to combat those issues because we are aware of them as well.
Thank you. I really appreciate it. I'm a big fan.
Ma'am, very quickly, just can you introduce yourself?
I'm sorry, my name is Talisha Odom-Zaladelli, and I'm the Wellness Coordinator at the Wellness Center.
Okay, thank you.
Thank
And
you.
the only thing I'll add here, so there is an annual budget, as Mr. Butler just mentioned. We have 4 staff, and the budget is allotted about $15,000 for incidental expenses. The headline for me with this report is just the establishment of metrics of accountability. That's the issue. And currently, we have 42 KPIs that we monitor, and the use of KPIs by every department is fairly a new phenomena for our district. It's not something that has cascaded and reaches every aspect of our district. It will not be difficult to establish those metrics. I think the challenge in terms of our performance is how many more metrics are we going to have added to our strategic plan. Currently, again, 42 metrics that we have already established as KPIs that we measure. But certainly that's achievable. We could probably do that today, right? Establish metrics. It's just where do they live? And I want to quantify, you asked me earlier, did I think the center was effective? And I unequivocally said yes, and I still feel like the answer to that is yes. I cannot measure it by data because of the lack of metrics. However, if one child's life in this district was impacted in a positive way because they had access to counseling services, it's effective.
Ms. Campbell had her hand up.
Okay.
I had a quick question based on something that Dr. Hoskins-Brown said. One thing I thought about was the referral process, and I'm not to jump ahead, but when it comes to the staff, it looks like they can just go if they feel like they need services. When it comes to students, it looked like they had to be, now I understand they're underage, but it sounded like they had to be referred by a teacher. Is that correct? Or can they go to a parent as well and speak to the parent and have the parent then take them?
So the referral process
Same
to
thing,
date.
ma'am. If you'll just introduce yourself.
Oh, I'm sorry, my apologies. Kim McGuire, Executive Director of Student Support Services. So to date, students can be referred either through a school counselor, administrator, dean of students, one of those members of staff. The reason why we have it set up that way is, one, we want the school to be included in this process because ultimately that is where the student is existing, and we want this to serve as a way of providing wraparound support. We don't want to do things in isolation, especially if those issues that they're experiencing are causing concerns in the school environment. So that has been the way that students can be referred. We have not had a direct referral process where a parent could just bypass the school and refer themselves. We have looked into what that would look like. But again, we want, because we are a part of the school district, we want the schools to be included in that process and seen as a part of that system of support that we're providing. But we have explored that, that option, especially with our high school students. But again, we would need parental consent if they're under 18. And, having that at the school site and getting that wet signature, if you will, that confirms that consent does support and help with that.
I like that. And I understand why we go through the school. I think that's important, so that everyone's included in managing this child's care in a productive way. But I guess for utilization, it's not just, for me, about a dollar amount that we attach to if it's effective or not and if it's efficient or not. It's that if a child does need help and we're only saying the teacher or the counselor or whomever can then send them, maybe there's a way to do it on the back end where if the parent says, I really think they need these services and I know the school offers them for free, I want to take them there, then maybe there's a form or something that we can have them fill out that says we do have to let the counselor or principal or fill in the blank know at the school so that we're all involved in the child's care. I love that, but then I think it would utilize it more, and then maybe some of these children that are still unreached that need the help could get it if it was more accessible in that way.
Understood. And just as a comparison, because with our Hazel Health telehealth, so far this year with our utilization of that, because parents can directly refer, 74% of our referrals actually still come from school staff, and only 26% actually come from the families.
Okay.
So even with that direct referral on that end, majority of our referrals are still coming from the school staff. But to your point, it is something that we have looked at and how we can, make sure that we are implementing that, effectively. And I think this process has helped us. We've always looked at our goals at the start of each year. And when we started this program, it was all about, utilization, going out into the community. One of the things that we want to do now is when we're going out into the community, it's a matter of, hey, we're doing this, but why isn't it landing the way that we want it to land? Initially, it was about the advertisement piece, but now it's about collecting some of that additional data to say, what else would help this to land and be of more support for you? And that's the transition that we're making at this point through Ms. Oladelli's leadership on that.
Thank you.
Yes, ma'am.
So on the KPI issue, I think this will be revisited in the board accountability meeting because that's the committee that owns all of these 40-something KPIs. I'm not disturbed by a high number of KPIs, but I understand that leadership is wanting to reduce them. So I think in the next meeting, we'll be receiving those recommendations. Mrs. Taylor has been working on trying to scale down the number of key performance indicators that we use to measure the district, and maybe some of them do need to be reduced. Like, are we going to stop monitoring bus arrivals just because it's no longer a KPI? No, parents are going to call. We're going to work on that anyway. So maybe that doesn't have to be one. But moving into a measurement of this kind that looks at the effect of preventative care, like how is discipline impacted? How much better are we servicing IEPs that through counseling that allows students to achieve and perform better? So if you're interested in this idea of how this will be measured, I feel like this is going to be on the agenda for the next Board Accountability Committee.
Thank you for that, Dr. Hoskins-Brown, and to your point, and thank you for that, Dr. Watts. While certainly there are, at this particular point, no specific key performance indicators in our strategic plan. The department does maintain metrics, and so part of our management action plan will be to be more intentional in sharing in terms of an annual report. Some of those things that they are monitoring, you heard Ms. McGuire talk about some data points from telehealth as compared to our wellness center services. So those are the kind of metrics that our team is monitoring internally. In addition to that, I know that some of what we could not share as part of the audit were some of the services provided directly to students and what the outcomes of those services were. But things like the number of students who were discharged based on the completion of their treatment plan, the number of strategic or serious threat consultations. So those are the kind of department metrics that our team is maintaining and monitoring. And while it does not have a direct connection to the key performance indicators in our current strategic plan, we'll be working to make sure that it's more aligned in some ways.
Are there any other comments? I would just note, reading ahead, that if I'm reading correctly, there were 119 strategic serious threat assessments last year. The number 1 is very important. The number 0 is even more important. So if we went and addressed all 119 of those serious threat assessments, then I don't know that as a taxpayer I care what it costs. But that's my final comment on that.
So our second observation has to do with district staff perceptions of procedures and services. So the services for students include individual counseling, serious threat assessments. The referral and intake process is somewhat similar. There's more documentation and a more involved process for the serious threat assessment. School staff are required to consult with the Wellness Center for that serious threat assessment process to provide some consistency in how those decisions are made. And once that process is complete, students and their families can choose whether to have that assessment conducted at the Wellness Center or be referred out to a provider in the community. So in talking with schools, staff at 14 of the schools described that serious threat assessment process as smooth and efficient. Another 14 schools described it as clunky and cumbersome. And some of the concerns of those staff included, the amount of paperwork, some redundancies in paperwork, the time involved for the process, some communication with the Wellness Center, and then, the school staff being the ones to schedule that assessment for the family with the Wellness Center. In the previous school year, there were 306 total referrals received by the Wellness Center from 52 different schools, so almost 90% of the district. School referrals range from, some schools had 0, obviously, but up to 25 referrals during the year. And then the distance to the Wellness Center was described sometimes as a barrier in getting there, but we found that the distance didn't seem to have as much of a correlation with how it was used. The school that had the most referrals was actually the school that's farthest driving distance from the Wellness Center. And we found similar patterns of referrals across grade bands. We were looking at referrals per 100 students just to, even the playing field and make sure we were comparing apples to apples there. But similar referral patterns across grade bands, across schools based on their distance to the Wellness Center. We also looked at the Wellness Center's staffing patterns. So we had just over 1,600 total service hours, and we looked at the staffing available and found that for those 1,600 plus hours, there were sufficient staff, and we're kind of looking at a minimum staffing availability here. So we were just looking at after school hours, just looking at the minimum amount of time those cohort counselors from the schools are at the Wellness Center, and we're still able to meet that need. Also, commenting that the Wellness Center is able to see students during the school day, which we didn't include in our review. The school counselors can work additional hours beyond the minimum one per week they're required, so there's more flexibility there as well. We asked about feedback that school staff receive from students and families that have utilized the Wellness Center. Feedback was, there wasn't a lot of feedback received, but it was generally positive during interviews and on the survey. So either positive or a mix of positive and negative. Very few instances of, just negative feedback overall. And then we asked staff in the survey, how familiar are you with the Wellness Center? And here's where we got a lot of staff responding that they're not familiar with the Wellness Center. So 60% rated themselves as not familiar at all. And then how do you receive information about the Wellness Center was one of the questions. 63% of staff responding said they don't receive information about the Wellness Center. So our recommendations here are to refine systems for soliciting feedback from district staff and students or families who utilize the Wellness Center services or access them for their students. And then use the data collected on metrics of accountability and that feedback that's collected to guide any potential changes to the Wellness Center procedures, and identify strategies to increase the Wellness Center's engagement with district staff to increase awareness of the center's offerings for both students and staff.
Are there any other questions? Okay. Thank you. There are no questions. I'll entertain a motion.
I move to accept the audit of the Wellness Center.
Is there a second? It's been properly moved and seconded that we accept the audit of the Wellness Center for submission to the Board of Education. All in favor? Thank you. Yes, ma'am.
The next two sections, the first one is the management action plan for December 2025. All people are in progress and are tasked. There's no past due at this time. If anybody has any questions, I will.
Well, yeah, I just have one question. The grading audit is in progress on page 33. And we've added a year. We're at June of 2026 now. Am I reading that correctly?
Right, but you want to?
We anticipate to be able to bring a new policy forth before June. There's a more extensive plan happening right now in terms of stakeholders beyond what you see on that document, but it shouldn't be an extension of a year.
The update was July of 2025, and I'm just reading the report. I don't know. It just says current date, June 2026.
So the June 2026 date just indicates that at the beginning of next school year, the intent is that the policy will be approved, the policy revisions. So, but the work around stakeholder engagement, that is ongoing throughout this school calendar year.
As recent as yesterday, because there's a lot of stakeholder input that has to be gathered. So we gave
Understood.
ourselves a runway.
Understood. I just wanted, just a big jump, just had to ask. Any other questions on the map? Yes, ma'am.
All right, the next area is our dashboard for our department. This is from December for this this audit committee meeting. And we've broken it up into audits and assurance services, audits and other services, which are also advisory services. So this gives you some progress of where we are with our audits. As we can see, we're halfway through the year and we're halfway in progress to what we're doing for conducting within the district. I do want to note that we want to highlight that if we say not started, even though you may see some hours put to it, there are times where either meetings come up or there's a discussion somewhere that we're a part of that we want to put those hours to. So I do want to highlight, and that's usually the survey work of an audit and not so much the actual field work. So if you see that it's not started, but there's actual days to that, that means the field work has not begun. Just wanted to highlight that.
Okay, thank you.
For advisory services, these are the areas of the non-audit services. Those are specific requests by management that we support. Internal office activities, this includes other department, doing risk assessment, getting those meetings together, building presentations and a wide variety of reviews or staff meetings. District support activities includes like ethics trainings, or this includes policy support for those policies that go to the board. It has a variety. If you would like for us to eventually give you a list of what falls underneath that, to give you more specific detail, we can. But this is where we are at this point. So we're halfway, through our year, and we're almost halfway through the projected to actual. So does anybody have any questions concerning those areas?
No, ma'am.
And so out of respect of showing you where we're spending our time in our professional development growth, we present on a monthly basis, not a cumulative, of where we are spending our time and what we're learning. So if anybody has any questions of our professional development that we have chosen to take, please let us know.
I have a question.
Yes, ma'am.
I just have a question. How much time does tracking your time take?
So we have a timekeeping system. We have a timekeeping system where it's a drop down. We've already built it. So usually daily is really daily or weekly is what I ask my team to put in, like, where did you spend your time during your day? And then Cheryl Hoffman's position is on a monthly basis to accumulate that, and that way I can review it on a monthly basis to see where people are spending their time in relation to the work and the outcome that I'm seeing occurring.
I was just wondering because at one point we had an issue in an office in an organization, and so we had folks do desk audits, which are really, really time consuming. And someone decided that it was a good management practice for people to keep doing desk audits. That's how that person decided to supervise the team, and it wasn't a good idea because all the time was spent tracking their time.
Right, no.
And so I just wondered, like, I see that you're changing the format of how you're reporting your time. Like, are you getting feedback about how time is being spent? Are we trying to do a better job of shaving down that? Like, are we focusing on this time in a different way for a reason, or are we just evolving our processes?
So this process has been in place for as long as I've been with the department, but the strategy that I'm doing it, especially now that we're remote, I am looking at, in my weekly meetings and seeing the work that's being completed, I'm looking towards those hours. But from a monthly perspective at this time, because I'm very comfortable that the adjustment to moving to remote is working really well for our team. But there will be some strategies looking at a yearly basis of the time that we spend there to should we be spending that much time, and where can we shift our resources?
Got
So
it.
we are
Okay.
looking at it from that perspective.
Thank you.
Are there any other questions? Then I'll entertain a motion to adjourn. We are adjourned. Thank you, everyone.